Hello there. If you're over 60, there's a good chance you've had a long relationship with medication. Maybe just a few pills a day, something for blood pressure, something for sleep, something for reflux. Or maybe it's a longer list, built up over the years, with some prescriptions you've been taking for so long, they've just become part of the routine. You trust your doctor, you've followed their advice, and for the most part, those medications probably helped. They eased symptoms, prevented complications, kept things under control. That's the power of good medicine. But here's something most people aren't told, and it's not your fault. As we get older, the way our body responds to medication changes. What helped you in your 50s may affect you very differently in your 70s. And some medications, even common ones that seem harmless, can begin to quietly age the body faster, especially after 60. They don't show up as side effects right away. Instead, they slowly wear down the things we're trying hardest to protect: memory, balance, energy, clarity, and often we don't notice until something feels off. Maybe you're feeling a little more tired than usual. Maybe your memory's not as sharp, or you've had a couple of stumbles or unsteady days that you can't quite explain. Now let me be clear, I'm not here to scare you. I'm not saying you should stop any medication cold turkey. That can be dangerous. But I do want to offer you something powerful: understanding. Because when we understand what certain medications might be doing to our aging body, especially over months or years, we gain the ability to ask the right questions, to have better conversations with our doctor, to make adjustments that support our health, rather than quietly working against it. So today we're going to walk through a few types of medications that may be speeding up aging, without you even realizing it. And more importantly, I'll share what you can ask your doctor instead. Gentle questions that open the door to safer, smarter alternatives that work with your body, not against it. And if this sounds like the kind of guidance you've been looking for, go ahead and hit the like button. It helps more people find this kind of honest, practical health advice. And feel free to subscribe too. We're here to help you age with clarity, confidence, and care. Let's start with one of the most commonly overlooked types of medication. They're called anticholinergics, and they might already be sitting in your bathroom cabinet without you realizing how they affect your brain. Have you ever taken something for an overactive bladder? Maybe you've used a little pink tablet to help you sleep? Or even an allergy pill now and then to dry up the sneezing? If so, you may have used a medication with something called anticholinergic properties. It's a long word, but here's the simple idea. These drugs block a certain brain chemical called acetylcholine, and acetylcholine is essential for attention, memory, and learning. Now, in younger adults, blocking it for short periods isn't usually a big issue. But in older brains, which are already more sensitive, long-term use of these medications can lead to fogginess, confusion, and even increase the risk of dementia over time. What makes this tricky is many of these medications don't scream brain risk on the label. They're hidden in common names like oxybutynin, which is often prescribed for bladder urgency, or diphenhydramine, the active ingredient in many over-the-counter sleep aids and allergy pills. Even some antidepressants like amitriptyline fall under this umbrella. And because these medications are available over the counter, many seniors don't even realize they're using something that affects the brain. A person might take an allergy pill each night for sleep, thinking it's harmless, but over time, that daily pill could be quietly wearing down memory and attention. You may not have been told that these medications can gradually dull mental sharpness, but more and more studies are showing just how sensitive the aging brain is to this class of drugs. So, what can you do? You don't have to suffer with bladder issues or allergies. But the next time you see your doctor, you might say, "Doctor, I read that some medications I'm on could affect memory. Is there a safer option for me, especially for my age?" There are often bladder training programs, newer medications with fewer brain effects, or natural sleep solutions that don't carry this risk. Sometimes even small lifestyle changes, like reducing caffeine or evening fluids, can help ease bladder symptoms enough to reduce reliance on these drugs. But unless we ask, we may never be offered these options, and every step we take to protect our brain is worth it. Now let's talk about sleep. I know many of you struggle with falling asleep or staying asleep through the night. It's frustrating, and it's real. And when nothing else works, many people are given medications like Zolpidem, You may know it as Ambien, or even lorazepam, clonazepam, or alprazolam. These are part of a group of medications that help calm the brain. And yes, they do work, at first. But here's what we've learned over the years. In people over 60, these medications often do more harm than good, especially when used for months or years. Why? Because they can reduce deep sleep quality, even though they make you fall asleep faster. That means you may spend more time asleep, but less time in the restorative stages your brain and body truly need. They can also cause next-day drowsiness, leading to falls, slowed reaction time, and trouble focusing. If you've ever woken up feeling groggy, a little off balance, or mentally fuzzy after taking one of these, you're not imagining it. More importantly, when taken long-term, these medications can weaken memory, especially short-term memory. In fact, studies have found that regular use in older adults can increase the risk of developing mild cognitive impairment, the early stage before dementia. And here's something many people don't realize. As we age, our liver and kidneys clear medications more slowly. So the same dose that felt fine in your 50s might now linger longer in your system, building up effects day after day. If you've been on one of these sleep aids for years, please don't stop them suddenly. That can be dangerous. But do ask your doctor. Could we talk about weaning off this medication slowly and trying other sleep strategies that don't affect memory or balance? There are safer options like low-dose melatonin, magnesium glycinate, or even CBTI, a type of structured sleep therapy that focuses on retraining your natural sleep rhythm. It works surprisingly well for seniors and is often covered by Medicare. Sleep is vital, but so is keeping your balance, memory, and daytime clarity. We don't want to trade one for the other, and in most cases, we don't have to. Now let's move to something that's in many medicine cabinets, those little pills for acid reflux and heartburn. If you're taking omeprazole, pantoprazole, or esomeprazole, they reduce stomach acid, which sounds helpful, and often is, especially for those with ulcers or severe acid reflux. But here's the catch. When taken long-term, and I mean more than a year, they can begin to interfere with how your body absorbs certain nutrients, especially magnesium, vitamin B12, and calcium. These are all nutrients that naturally become harder to absorb as we age, even without medication interference. Magnesium supports muscle and nerve function. Vitamin B12 is key for energy and sharp thinking. And calcium, of course, is vital for bone strength. When these levels drop quietly over time, seniors may begin to experience fatigue, muscle cramps, or mental fog, and never suspect their acid-reducing pill could be part of the problem. There's also increasing research suggesting a possible link between long-term PPI use and cognitive decline, especially in older adults. While not all studies agree, there's enough evidence to take it seriously, especially when these drugs are used for years without reassessment. In addition, reducing stomach acid too much can leave your body more vulnerable to intestinal infections like Clostridium difficile, particularly in hospitals or care settings. So if you've been taking a PPI for years, ask your doctor, is there a way to reduce my dose, take breaks, or manage this with diet instead? In many cases, yes. Small but consistent changes, like avoiding heavy meals before bed, eating more slowly, reducing processed foods, and elevating the head during sleep, can help ease reflux naturally. Some people can reduce or even stop PPIs gradually under medical guidance. It's not about going without help. It's about giving your body the nutrients it needs to stay sharp, energized, and resilient. Have you tried easing off reflux meds or managing it naturally? You're using what's called a proton pump inhibitor, or PPI. Share what's worked for you in the comments. Your experience might help someone else, too. Let me gently bring up one more group that isn't always labeled clearly, and that's the use of certain antipsychotic medications, not for schizophrenia or psychosis, but for sleep, agitation, or behavioral issues in older adults. Names like quetiapine, Seroquel, risperidone, or olanzapine are sometimes given off-label, meaning not originally intended for this use, especially in older adults with dementia or just difficulty sleeping. These medications can make a person feel calmer or drowsy, and in moments of distress, especially in memory care settings or hospitals, that might feel like a relief. But long-term, the cost can be high. Studies show that in elders, particularly those with cognitive decline, these medications can increase confusion, sedation, and even the risk of stroke or early death. And even in relatively healthy seniors, they may quietly worsen balance, reduce motivation, and increase the chance of falls. It's important to know that these medications don't treat the root cause of sleep issues or restlessness in aging brains. They simply dampen the nervous system. That might help temporarily, but over time, it can rob a person of their personality, their energy, and their independence. If you or a loved one has been prescribed one of these medications for sleep, mild agitation, or anxiety, it's okay to ask, is this medication still necessary for me? Could we try a safer or more targeted approach? Sometimes sleep improves more with routine, light exposure during the day, music, comfort, or safe herbal options than with sedating pills. You deserve care that supports who you are, not just calms the symptoms. Now let's touch briefly on a medication that's widely used, statins. These are cholesterol-lowering drugs like simvastatin, atorvastatin, or rosuvastatin. For millions of adults, statins have played a major role in reducing the risk of heart attacks and strokes. And for many younger seniors, especially those with diabetes or a history of heart disease, statins are a key part of staying well. But in frail or very elderly adults, the picture is a bit different. As we reach our late 70s, 80s, and beyond, the side effects of statins may become more noticeable than their benefits, especially if heart risk is otherwise low. Common side effects include muscle pain, tiredness, and in some cases, a kind of general brain fog, that feeling of being just a little slower, less sharp, or more drained than usual. It's not that statins are dangerous. For many, they're life-saving. But for some elders, particularly those who are thin, fatigued, or dealing with multiple medications, statins can contribute to overall weakness, reduced physical function, and less quality of life. There's also evidence that in some frail seniors, cholesterol levels that are too low might actually increase mortality, especially if weight loss or malnutrition is present. So it's worth asking, given my age and health status, do you think I still need this statin? Could the risks now outweigh the benefits? Your doctor might suggest continuing at a lower dose, pausing to reassess, or maintaining it if there's strong reason to do so. The key is not to fear the medication, but not to assume it's always necessary forever either. This stage of life deserves medications that support your energy, not ones that slowly chip away at it. Have you or someone you love ever been prescribed a statin later in life? Feel free to share your experience in the comments. It helps others know they're not alone. Let's talk for a moment about antihistamines, those medications you might take for seasonal allergies, itchy skin, or even as part of your sleep routine. If you've used something like chlorpheniramine, hydroxyzine, or even meclizine for motion sickness, you've likely taken what's called a first-generation antihistamine. These drugs have been around for a long time, and while they can certainly help in the short term, they come with some side effects that become more pronounced with age. Unlike newer antihistamines that target only allergy symptoms, these older medications cross into the brain, where they can cause drowsiness, slowed thinking, dry mouth, and even confusion, especially when used regularly. In younger adults, the effects wear off, but in people over 60, particularly those who use these medications daily or for sleep, they can gradually dull mental clarity, cause blurred vision, and increase the risk of falls and daytime sleepiness. What's more, many people don't realize these medications have strong anticholinergic effects, the same ones we talked about earlier that can contribute to memory decline over time. If you've been using an older antihistamine every day, maybe as a sleep aid or allergy pill, it's worth asking your doctor, could I switch to a newer, safer alternative, or even try managing this with non-drug options? Today we have non-drowsy antihistamines like loratadine or cetirizine that don't cross into the brain, and for sleep, there may be better long-term options that won't leave you groggy, forgetful, or off balance the next morning. A small change here can go a long way in protecting your sharpness, your steps, and your overall well-being. Now let's talk about something that many people over 60 are prescribed at some point: muscle relaxants. If you've had back pain, neck tension, or chronic stiffness, your doctor may have given you a prescription like cyclobenzaprine, carisoprodol, or methocarbamol. These medications help relax tight muscles. And they do have their place, especially for short-term use after an injury. But here's the concern. When taken regularly, or for longer than a few weeks, these drugs can accumulate in older bodies and lead to a wide range of issues that feel a lot like aging, but are actually medication side effects. Many seniors on muscle relaxants report feeling groggy, slow to think, or even emotionally flat. Their balance may worsen, and they may feel more vulnerable to falls, especially if they're already on other sedating medications. Cyclobenzaprine, in particular, is known to stay in the system longer in older adults. Its chemical structure is very similar to older antidepressants, meaning it can affect brain function, blood pressure, and even the bladder. If you've been on a muscle relaxant for weeks or months, especially without reviewing whether it's still needed, this is a good time to check in. You can say, "Doctor, I've been on this muscle relaxant for a while. Could it be making me feel more tired or unsteady? Do I still need it?" Often, physical therapy, heat therapy, gentle movement, or magnesium-rich foods can help manage chronic tightness without sedation. You deserve pain relief, but not at the cost of your energy or alertness. Now, if you heard a medication on this list that you're currently taking, whether it's something you've been on for years or something newly prescribed, please don't panic. And please don't stop anything on your own. The goal of this conversation isn't to alarm you, it's to equip you. Because in this stage of life, knowledge really is power, and having a clear, informed conversation with your doctor can make all the difference. Here's something many people don't realize. Doctors don't always know what you're feeling unless you bring it up. If you've been more tired lately, or having memory slips, or just not feeling like yourself, and you're on one or more of these medications, that could be part of the story. But unless you speak up, your doctor may just assume things are fine. That's why it's important to regularly revisit your medication list as you age. Not just to refill prescriptions, but to reevaluate whether each one is still helping, or whether it might now be doing more harm than good. A thoughtful review can uncover safer alternatives, gentler doses, or even non-drug options that may support your health better at this stage of life. And making even a small adjustment, just one change at a time, can often lead to clearer thinking, better energy, or fewer stumbles and side effects. This isn't about stopping everything. It's about refining your care to match who you are today, not who you were 10 or 20 years ago. Your needs have changed. Your body has changed. And good care should change with you. You're not being difficult. You're being proactive. And that's one of the smartest things you can do for your health and independence. Because aging well isn't about doing everything perfectly. It's about staying informed, staying involved, and making thoughtful choices as your needs evolve. The more you understand your medications, the more power you have to protect your energy, memory, and quality of life. Your health is still yours to shape, one step, one conversation, one adjustment at a time, and you deserve care that grows with you. If this message felt helpful or reassuring, give this video a like. It helps others find this kind of thoughtful health advice. Feel free to share it with someone you care about, and let us know in the comments if you've ever had a medication review or are planning to talk with your doctor soon. And if you'd like more gentle, practical guidance like this, go ahead and subscribe, and tap the bell so you don't miss the next one.